Sherry Krupla. I'm a caregiver here at the Lake Chelan Community Hospital, as well as a manager of the Med-Surg unit. I have been a caregiver here for 7 years. Our goals here at the hospital are to provide excellent care for the patients that we support here. And probably one of the biggest challenges we have on the Med-Surg unit is simply space. So when our hospital was built, having 2 patients per room was the standard of care. It was not unusual, and it was probably more extravagant to have a patient having their own room. Since then, we've found that with patients needing the rest and they needing the privacy, this will provide a quicker healing. It shortens their illness, it increases their potential to heal quickly and have a better resolution to whatever illness they have. And this just doesn't happen when we have to put 2 patients in a room and have families coming to visit. In our rooms, the standard of size of our room, even for 1 patient, is small. It's hard to include families even in one of our single patient rooms. Another challenge is just infection control. We have to be very careful of who goes into rooms together. We have problems with male-female. So there are times when we have a bed available, but because of the male-female issue, that we've had to transport people to Wenatchee. Another issue we have with sharing rooms is just the lack of privacy. When there is simply a curtain between you and the patient next to you, and the doctor's coming in and asking personal questions about how you're doing, there's absolutely no privacy. And we can ask the other family members to step out, but obviously you can't ask the other patient to leave. We had one situation where, unfortunately, as hard as we try to prevent this, we had a person who was on end-of-life care and had to put temporarily a patient in the room with them. And I know that with the feedback we received from that patient later was that it was so hard for her to be close and hear what's going on with the family and the patient who is passing and feel like she's invading on their privacy.